And all right. So can you just tell me about a Scenic City Neurotherapy? What is the
We do therapies that enhance the way the brain communicates with itself and with the body. It's neuroregenerative therapy. We utilize ketamine infusion therapy, transcranial magnetic stimulation as tools to optimize cognition, functionality. We treat chronic pain disorders in a non-opioid, non-narcotic fashion.
and specifically Matthew Perry's death, how is that bringing attention to the issue of people self-administering ketamine?
One of the concerns has always been in this space is the dangerous practice of self-administration of ketamine. Um, all rapid acting anesthetics, even ones as passive as ketamine, uh, carry an inherent risk. It's, the drug sets up quickly, goes in quickly, and the patient can find themselves in a bad space uh, from a safety perspective if they don't have somebody there to manage them. And people that do this on their own, which is a common practice throughout the country, to utilize ketamine for mental health treatment, but we all recommend that this be done under medical supervision, all the medical providers that offer this. There are a few companies out there that will mail it to your house after a 20-minute Zoom call, and they're passing on this risk to the patient without informing the patients that this is a potential outcome if they're not don't have someone there to take care of them. We don't have issues like this in clinic because this is primarily seen with an oral or sublingual administration of ketamine. We only administer an IV version, which is what the literature recommends.
And as far as the Chattanooga area, have you, found out about cases where people are self-administering ketamine into themselves?
Absolutely. There is, I do know of a couple of providers locally that will actually send it home. I don't think it's out of malice. I think it's mostly out of ignorance. They just don't understand what they're prescribing. They want to treat it like a pill. It's like that fixes things, and that's not how this process works. This is a brain health treatment, and unless we're using this appropriately in a safe environment, a patient can hurt themselves. And I've heard of a couple of cases in the Tennessee Valley actually where patients have died at home with self-administered ketamine.
And you had mentioned a bit earlier that a lot of people are using it to treat mental health. Is that something that you've seen increase in recent years, or is this something that has been going on for a while now?
For about the last 15 years, we found that when we stimulate this neuroprotective, neuroregenerative response that ketamine causes, we can actually treat mental health in a way that we've never been able to treat it before. We're actually able to rebuild the way the brain communicates to itself. It's a process called dendritic arborization. It's where the pathways between brain cells regrow. It's like upgrading how your brain communicates with itself. It doesn't make people feel good. It makes them feel correctly. And so that's what we see with with depression and anxiety, is that things that should feel good don't feel good. And that's what this does, is this makes your brain have the correct response to your environment. And so what we're seeing uh, in the space is that it's kind of a game changer in mental health management overall. But the problems that we're seeing are just, ill-informed providers and even worse informed patients thinking they can do this safely at home by themselves. And I understand that would be more convenient, but this is a rapid acting anesthetic, and it comes with these inherent risks. And if we don't manage them properly, we start to see these things happen.
And is ketamine, are we seeing it being used by teenagers and children as well?
It just depends on, it's a case by case, typically with most providers under the age of 18. Um, it is it is something that is able to be utilized in a safe environment in the clinic under medical supervision. Um, but yes, there's always been people utilizing ketamine for multiple purposes outside of the clinic environment.
And I'm so sorry, I did not ask you your title. Can you tell me your title?
I'm a certified registered nurse anesthetist. We manage anesthesia, and ketamine being an anesthetic, it's one of the primary anesthetics we use for children 6 months and older in surgery. It's an adjunct in almost every surgical procedure we do. And so the safe and ethical administration of anesthesia is kind of our purview.
Hmm.
So if you have
And
surgery, we're the ones that put you to sleep.
gotcha. Um, in your career field, hearing the news, because we're relating it back to Matthew Perry's
Mhm.
passing, um, I guess what went through your mind when you found out when the consensus on his how he died came out? What was your reaction to that? Was it surprising? And have you seen other cases similar to this where people have passed after self-inflicting with ketamine?
The self-administration of ketamine has caused numerous deaths, even when taken as prescribed. And I think that's something that people aren't catching with Matthew Perry is that this is not an illicit abuse of ketamine in all likelihood. This is him taking the ketamine that somebody prescribed to him at home. It's just the environment he took it because he didn't die from the ketamine. He died from drowning. It's just he took ketamine in water, in a hot tub. And so this is where the misinformation comes into play is that, the ketamine didn't harm him. It wouldn't have harmed him if he was being medically supervised. We lost him because did this in an environment by himself that was unsafe. And
So
we have
that's
seen, yeah.
interesting. Do you believe the hot tub played any part of that? Is that like a dangerous environment to be being administering of this drug?
Think of anesthesia. So, like,
Mhm.
where should we get anesthesia? Should we get it at home? Should we give it to ourselves? Probably not. Self administration of anesthesia is historically a bad idea. When you get anesthesia of any form, whether it be ketamine or any other drug, needs to be monitored. You need to have your heart rate, blood pressure, respiratory rate, oxygen. All of these things need to be monitored, and you need to have somebody there that can intervene, that understands and is able to interpret these vital signs to determine what the appropriate intervention would be. This is what happens when nobody's watching. This is recklessness, and it's not just recklessness on the patient's part. In fact, I don't blame the patient at all. This is the providers prescribing that are putting the patients at risk.
And so I guess through all of this, what would be your message to the patients that you serve in the Tennessee Valley area, just about the self-administration of ketamine, any safety precautions, things of that nature? Would be your main message towards them?
Well, understand that the reason we don't offer an at-home version of ketamine to our patients is because ethically and it's terribly unsafe. Um, it would be so much more profitable from a business perspective to pander to that specific clientele, but our goal is patient safety first, efficacy, safety, and comfort of the patient, as it should be. The patient, we have to be advocates for our patients, and instead of advocating for our pocketbooks, which unfortunately that's not always the case in medicine, is that people will perform unethical or unnecessary treatment processes and procedures that um, just just because they can sell it.
Okay. And is there anything else I didn't ask you or anything else that you wanted to add?
Just remember that self-administration of anesthesia is always a bad idea. You need to always have somebody who is able to take care of you in whatever way you need to happen, which means that it's probably somebody certified in the management of an anesthetic. That means it needs to be somebody higher than than an RN. Um, but even RNs, I worked with some incredibly capable ones. But it's in this case, being able to manage an airway, being able to understand these drugs and has worked with them, make sure that what you're doing is not going to potentially make you worse. The patient should never absorb risk uh, for convenience.
Awesome. Alrighty, I'm gonna hit the end record button.